Hi everyone, this is Dr. Merhaut with Elite Sports and Spine Chiropractic. Welcome to this week's Elite Education series. Today I'm going to be discussing things about concussion. What is a concussion? How do you identify concussion? What's the appropriate protocol to return someone back to play? Some misconceptions with it, so things like that. So basically with concussion, it's a neurological thing that happens often due to a jarring of the brain itself. So it's a brain damage type of injury that occurs due to a force. Now that force does not have to be directly to the head. That's a big misconception. Some people think you have to get hit in the head to sustain a concussion, which is not the case. You can have a whiplash type injury, and that still jarring of the brain, that forward-backward motion can cause a concussion. So things to look for with any severe type of hit to the body and or the head are these concussion symptoms. So a lucid interval, having brain fog, that kind of thing. If there was any type of loss of consciousness, that's a red flag right away. If there was loss of consciousness and there's amnesia, where they're not remembering things, whether it's prior to getting hit or they're not remembering things after they got hit, those are red flags. If they're just not themselves, if they're around people that are close to them and people are realizing or noticing that they're just not the same personality that they used to have, that's also a red flag that you should be concerned about. If their sleep habits are abnormal, their eating habits are abnormal, they have any type of headache, that's also a red flag. One of those things that you want to be really aware of is if the symptoms just progressively keep getting worse. There's potential if there was a head injury or there was a blow to the head, there could be some type of brain bleed going on. The brain bleeds, they can be fast and symptoms can progress really quickly, or they can be really slow over the course of a couple hours or a couple days, and then the severity can worsen over the course of a couple hours or a couple days. So if there's ever any type of severe blow and just the athlete is not, it doesn't even have to be an athlete, it could be a car accident, or someone's playing Frisbee and they get hit in the back of the head or something like that. Noticing those types of things, it's important to go get checked out by someone who's trained to assess for concussion. One other important thing is pre-participation concussion screening. So if you're already going to be participating in a sport, it's not a bad idea to get a baseline. One of the tools that we use here in the office is called the SCAT-3. You take it through a series of different tests. There's neurological testing, there's range of motion, there's balance testing, a couple different things that we assess initially to determine where your baseline is, and then we retest if we have a baseline with that same test to see if there's concussion related to that. So it's not a bad idea if you're about to participate in a sport to come in and get a preseason assessment done, so that if you do get hit and you're suspecting that you may have a concussion, then we can do a follow-up analysis and determine if it's necessary to go through return to play guidelines for concussion. So a little bit about return to play guidelines. Initially, when you sustain a concussion, a lot of things with technology should be limited. So screen time, video games, texting, all those kinds of things should be limited. If anything is provoking concussion-like symptoms, then you shouldn't be doing those activities until those symptoms resolve to add those activities back in. If it's a student and they're going to class and they're not able to concentrate, they're having headaches in class, then it's important to write the teacher, so the doctor will write a teacher a note and say this student is experiencing concussion-like symptoms, they can't be participating fully at this time in class, so excuse them if they need to be excused. We monitor those symptoms throughout the process if we are suspecting a concussion, and then we're allowed to give them the recommendations on when you're allowed to go back and participate in class fully and those kind of things. Other things we do is you gradually work them through stressing their body. So you first initially get their heart rate up, and then you work on adding sport-specific exercises and that all the way up until you can have them practice. If they're having symptoms with any of those activities, then you have to drop them back down to the next step and then wait a full 24 hours before you can progress them to the next step. So oftentimes when you see in the professional sports field, even college field, where someone has a concussion or they're going through concussion protocol, that's often what they're doing. They're making sure and monitoring their symptoms to make sure they're not having symptoms with increasing their physical activity levels up until they can participate in practice and then fully participate in whatever event they're doing, whether it's a game or a meet or something like that. So that's the return to play guidelines in short, but there's a lot more that goes into that, but that's kind of what it is. So if you have questions on concussion, feel free to comment below. There's a lot involved with concussion, whether it's dietary guidelines on how to help with the brain healing, and then exercise guidelines and all that kind of stuff. So feel free to comment on questions. I'm happy to do a follow-up video. Referring back to last week's video, we had a question on exercise duration. So Chris and I are going to be doing a video next week that's going to address that question that was had. So tune in next week for the Elite Education series. We'll be talking about exercise duration, when it's appropriate to do certain lengths, whether it's you're only doing 30 minutes or you need to train longer or shorter, whatever your goals are. We'll be talking about that kind of thing. So feel free to tune into that episode of the Elite Education series next week. I'm Dr. Merhaut. Thanks for tuning in, and I hope to see you next week.